That's your memo here. And so we have a committee here of us that attended DC together. And we are, most of us are here on the call and going to present bits and pieces of what that experience was like for us. And so those of us that are going to speak are going to be Nikki, who is one of our representatives of ANA, Molly, Maxwell, Sarah McCumber, myself, Cammie, Mary Tucker, Jenny Tucker. I'm sorry, Steph. Let me just see here. I'm scrolling here. Oh, there we go. Pardon me, my computer's misbehaving. Molly, Sarah McCumber, Cammie Peterson, Mary Tanner, Jenny Tucker, and Stephanie Whitwer. And so without further ado, I believe that Kathy's going to kick us off with the first two people that are going to present. Do you have slides, Kathy?
I don't have slides for Sarah and Jenny. If they have slides, they can share them. But
yeah, I can share it. Is that all right?
Yeah, that'd be perfect.
Did it there.
Perfect.
Jennifer, did you want to start off or how do you want to do it?
Sure. Yeah, I'll go ahead and start. So whenever we go to membership assembly in DC every June-ish, it sometimes moves, we are able to come together, but the first day that, so the membership assembly is 2 days, but then the day before membership assembly happens is Day on the Hill. And so we usually have, other people who maybe aren't membership assembly representatives who come usually from like closer surrounding states. They'll get some larger contingencies, but it's just really an opportunity to kind of have a collective voice and really work on some key issues. Or as in our case, throw in kind of our own curveball that didn't quite make the cut of bills that we were talking about. But there was over 400 nurses in the room when we started, and we got to meet with, I think, the two Senate offices. And I had to count this up because I had 4 representatives meetings that I went to. And I know that Mary, Tanner, and Sarah, you guys went to 1 or 2 other ones, right? Yeah. We hit almost the whole state. There was just a couple, I think 1 or 2 that we missed or that we didn't get meetings. But we kind of covered, the meetings would usually start on a certain topic of kind of, they'd ask us, what are we here to talk about? And then we would sometimes weave in different ways, but really hitting on the bills that we'll kind of, Sarah and I will talk about, and just looking at, how do nurses make a difference, getting those personal stories out there, which I really think they like to hear, which is really fun to be with such a big group that we had from Minnesota, and being able to, really advocate for our profession and just the things that we need and the things that we should be seeing. And also ask for their support and asking for them to be co-sponsor. That's always sometimes an easy get, sometimes not an easy get, but it's worth something to ask. I'm going to let you hit the next one, Sarah.
Okay, so I'll talk about the first bill that we talked about. It's called the ICANN Act, and it's particularly relevant to advanced practice nurses. It's about improving care and access to nurses. When we went in June, it had not been introduced in the Senate, but I found out from the AANP website that it was just introduced last week. And it really is based on looking at removing arbitrary and outdated barriers in Medicaid and MA programs that really prevent APRNs from practicing to the full extent of our education and clinical practice. Another way to think about that was Medicare was created in 1965, and that's when NPs were birthed. So that's why we're kind of silent there. I think a big thing is it does not supersede state laws or change provider scope of practice, because that's a significant issue for many states. And I thought it was interesting that it said that NPs provide more than 50% of the primary care to Medicare patients. There was a question that was brought forward when we met with one of, I think it was one of the representatives. They wanted to know what the Congressional Budget Office report was, the CBO report for costs. So that's always important to know. There's multiple areas or things that it will remove Barriers right now, one thing that's because I'm in geriatrics, there's a requirement that when folks go into skilled nursing facilities, their care has to be provided under the supervision of a physician, and it would remove that barrier and allow us to perform admitting exams and all required Medicare patient assessments. There's many other parts to the law. If you're really interested in learning more about it, I would recommend that you go to the American Association of Nurse Practitioners. They have a great website on it. So, Jenny, I don't know if we just want to go through it quickly.
Well, the
but-
one thing just to point out about this bill is it's what they call kind of like an omnibus bill. So if you've never heard that before, it really is like a kind of a compilation of a bunch of different small bills. So certain pieces of this may get pulled and passed in different ways versus just the whole thing. So
Right.
you may, over time hear little bits of that. That's one thing that was interesting to really just dive into that morning at Day on the Hill to kind of learn about this one.
Did you want to talk about the next one or did
Yeah.
you want me to?
I can. So the biggest one we talked about, healthcare worker burnout, but also violence prevention. So there is a bill both in the House and the Senate that really looks at the Department of Labor, really pushing them to issue, interim and then final standards to get OSHA to get off their backside because they're just not making any movement on this. And we need it badly if this last week has not been a good exemplar of that, if anybody hasn't seen the news. But really just makes employers, puts them kind of on the line for having action to protect all the staff members. They're saying they're going to do it for a very long period of time. They haven't done it. And then also the other part of it is just getting rid of mandatory overtime. So this one actually has a decent number of co-sponsors. I know as far as from the state of Minnesota, and this is just the ones that I went to, both Betty McCollum and Angie Craig are co-sponsors on it in the House, and then Amy and Tina are both co-sponsors in the Senate. So it's just, it's kind of one of those things. I think it's got a lot of support. We just gotta get it pushed through.
And then there was no specific ANA legislation that they were advocating for around the nurse staffing crisis, but and I know Kathy was just on the nurse staffing task force, and I think you've probably presented on that previously. But the principles that they were focusing on were in implementing enforceable nurse staffing standards. Staffing standards alone will not resolve the staffing crisis. And also talking that education and training resources will not serve the nursing staffing crisis. And when I was preparing these slides, what I thought was interesting was that there was ANA had a news release that went out about 2 weeks ago that ANA really was underscoring the urgency for safe staffing solutions, including minimum nurse to patient ratios. And that was a big change that came out of last year's House of Delegate or membership assembly. So stay tuned.
Yeah.
And Stephanie, Dr. Whitwer, are you going to talk about the Chronic Care Management Improvement Act?
Well, I can talk a little bit about the act, but I certainly wasn't there to hear the discussion and conversation on the
Okay.
Hill.
Well, we just brought this forward.
Proceed.
This was something that grassroots came out of our because you're a member of MNOR, and we brought it forward to talk about people encouraging, advocating for the cost sharing of eliminating the cost sharing for chronic care management services. And you can, if you want to say anything more about it.
Jennifer, were you gonna?
I was gonna say, I
Jason?
can't remember who in our meetings, but somebody dubbed it the unicorn bill
Hmm.
because it had nursing, medicine, and insurance support. And when do you ever find that? So why people
Yeah.
aren't getting on board with this, and let's get this thing pushed through because something's gonna happen to make it not be, everybody's not cooperating anymore. So let's just get it done. And a lot of people were really open and really responsive to this one, I felt.
Yeah, for those of you who don't work in ambulatory care, there are particular codes that nurses can bill for. They're time-based codes, and they provide reimbursement into the practice. It's an incident to code. But it helps support the ability to do chronic care management virtually for the most part. And it could be face-to-face too, but there are time-based codes that are billed monthly and only under general supervision. So it really allows the RNs to work at top of license. And some of our older patients that are have restricted incomes refuse to participate in chronic care management because you have to give consent to be able to do this. And if they don't give consent, you can't, well, you can provide the service, but you can't bill for it, I guess. But it does become a financial burden for some people who can't afford additional expenses for their medical care.
Yeah. And then there was discussion of a National Nursing Workforce Center. Bill, Minnesota, we haven't had this. The nearest state nursing workforce centers that have worked I looked at the information was Wisconsin, North Dakota, and South Dakota. It was just talking about a pilot program enabling existing state nursing workforce centers to boost local nursing workforces and better evaluate the recruitment and retention of nurses. And then I just wanted to conclude with, there is a congressional nursing caucus, and there were no Minnesota representatives, House of Representatives, members of the caucus, but Senator Klobuchar was a member. So I don't know if we got anybody else to join. Did you have anything else you wanted to add, Jennifer?
I think that was it, and just open it, I guess. I don't know if we want to be able to take questions right now, Kathy, or if
Or
anybody.
do you want to keep going?
I think if somebody had a question, they could ask. I will say about the nursing caucus that there had been people who are representatives who had been on it, but every once in a while they just kind of like wipe all the slates clean and start fresh because, so they reapply to be on or resubmit their names to be on these caucuses. So I was looking to see if we had any, but I wasn't successful, so I'll ask ANA. Did anyone have any questions for?
No, but great presentation.
It was really fun, wasn't it? The going to the hill. It's always fun.
It's hot, bring comfortable walking shoes, and make sure you stay hydrated. And really, even if you aren't, I would like to put a plug out there, is even if you aren't necessarily an elected representative to go to membership assembly, but are interested in going to Day on the Hill, you're more than welcome to come out. You would have, and you can do that. And then a lot of people just pay their own way. They'll come like for a night or two or something. But it is an option, to come out for Day on the Hill. And if you've never experienced it before, it's really a really interesting time to be there.
I would also add, Jennifer, that a lot of times, some of the things they were saying, have you contacted your local office? Because a lot of them have local offices in the region. And so you don't necessarily even have to go out to Washington to be able to see them. They come back into Minnesota. In fact, we had some, I think, that were actually already back in Minnesota to really take time to talk about your issues. And sometimes it's even it's heard a little bit more because they're in their home area and it's very real, versus being pulled into meetings and that type of stuff out in Washington. So advocacy is really at a heart of a lot of things that occur and that impact us in nursing. And so advocacy and legislation is just huge in nursing and how it impacts us all.
Well, and Cami, you had you were advocating for a nurse who was having trouble with a visa and
Yes.
getting some responses to that.
Yes. We
Have you-
actually got a partial work visa for her, so.
Awesome.
Great.
Mhm.
And most of them have booths at the state fair. So if you go to the state fair, make a point of dropping by, saying you're a nurse and what your concerns are, because they do listen.
If nurses are experts in their field. Be the voice to make the change.
Is the information they're getting from MNORN consistent with the information they're getting from MNA? Or are they hearing different stories?
I think this the NNU has been pushing a staffing bill for a long time that was first introduced, I think, in like 2003 or 4. And ANA hasn't taken a position on that bill, but they're looking at it again with new eyes and trying to like figure out, you know, is there a way to modernize it a bit? I don't know that we're working on things that are in conflict, but that our emphasis might be on different things right now.
The scope of, you know, MNRN and ANA is just wider. As far as I feel the scope of advocacy is just wider.
It was really fun to be able to meet some of the ANA leaders in terms of the advocacy work that's going on. So they offered up a educational session at noon one day, and it was really interesting, I think, to hear, you know, kind of how they do their work and you know, how they advance the nursing issues through ANA.
And there again, we lobby ANA because like I lobbied them to take up the bill that Cami was, or that Stephanie was talking about, and they ended up signing on to a letter. And you know, I was just lobbying them on some stuff around long-term care. So we try pushing issues up to them as much as we can, because they know, they see things from their perspective, but they don't see them from, you know, the grassroots in Minnesota. So I'm always putting a bug in their ears. So sometimes it works. So what should we move to elections? We've have 2 people who've been successful this year. Nicole got elected, and Molly Maxwell was her campaign manager. So we have 2 heroes to talk to us now about what happened.
Well, I will start it, and just a little overview about the elections in general at ANA. They take place every year, and about half of the board is elected each year, and the other half the following year. This year we had 5 members that were elected, and next year we will have 4 members next year. There were 4 members this year that were elected. Things have changed a lot for anybody that used to go to the convention when we had many more days. There was a lot of campaigning and a lot of excitement around the campaign taking place right there. But now the membership assembly is much more compact. We have less time to do it. So a lot of stuff is done beforehand. The candidates decide they want to run. They have to let the nominations and election committee know that they're interested, and then they are approved to run. They kind of look at their background and their experience and determine, and Jenny can probably tell us more about that since she's been on that committee several times. But like I said, a lot of stuff takes place beforehand. So people, and today with all the modern technology, I was blown away. A lot of really nice videos came out with the candidates introducing themselves. It's sent to every member that is got a vote at the membership assembly, and it's their option to read and get to know them via a video. Let's see, that's pretty much it as overall. This year we had the elections that the people that ran and that won will be new to the board of directors. Our vice president, Anita Gerard, is from California ANA. The treasurer is Joan
She
Whitmer.
was born in Cherry, Minnesota, which is up on the Iron Range. So Mary Tanner and I, we were talking to her, and she goes, well, I'm from northern Minnesota. And we said, where? She didn't know that anybody knew where Cherry was. So
Only you guys that live up there know that. Joan Whitmer was elected as treasurer. She's from the New Hampshire Nurse Association. A woman named Kalia Fisher Grace was from the individual member division, and she was selected as director at large. And then, of course, the director at large recent grad is our own Nicole Abel. And she will tell you about her experience as a new grad and as a first-time delegate, or first time going to the convention, let alone being a candidate and learning all the things she had to do. Also, the continuing board, Jennifer Mensick Kennedy will remain, it has another year on her term as president. Amanda Oliver is secretary, she has another year. Director at large is Edward Briggs from Florida. Director at large staff nurse is Jacob Garcia from Washington State Nurses. And other director at large is Jennifer Gill from New Jersey State Nurses Association. So that's who your board of directors is. Also, the nominations and elections committee had elections also. Half of that board was elected and then half will continue for another year. And Jenny can talk about that if she needs to. They oftentimes, they usually announce in the late fall that nominations are looking for candidates. They post it in all the communications, and oftentimes re-announce that again after the first of the year. It always seems like they don't seem to get the number they want. And so you will see the notifications if you're interested in running. We've been pretty successful over the years, so go ahead, Miss Board Member. Where are
Thank
you?
you. I actually have a presentation.
Yay.
Slides. It was such a great experience. How can I not have slides? Okay.
She had beautiful stuff, I have to say. She did a lot of it.
So this is for just the 2023 ANA Membership Assembly elections. And our objective was really just to describe the process for the elections and who was elected, as Molly already mentioned. I just want to also point out, Molly was my campaign manager, but I really want to mention Sarah, who I call the bulldozer. She really put my name out there as well. And this is just a little introduction of our experience. I'm a CVICU nurse at Mayo Clinic, and Molly is a staff nurse. And then, Sarah is a professor right now as well. And these bios were
More of a networker than a bulldozer, but I don't take no for an answer.
I would like to say bulldozer because you are amazing. And I mean that with all due respect. It's a great word for you. Let's see. So questions to be put on the ballot. I put up 2 of the questions. There were, I want to say 5 or 6 questions that you had to have answered to be able to, for the NEC to vet you and see if you were qualified enough to run. And 2 of the questions were describe what you see are the 3 most significant challenges facing the ANA and propose the solutions. And then the second one was just talking about how you have been able to influence through your state association or any other association. And I really just talked about my experience with the Minnesota Organization of Registered Nurses, and really, sorry, you hear my dog. And also I was on the board for the National Student Nursing Association, and I am also an elected member for Mayo Clinic's Equity, Inclusion, and Diversity Council. So I really just talked about all of those things. And I was successful in getting on the ballot. For the ANA elective positions include 4 officers and 5 director positions on the board and 7 positions for the NEC. And for the recent graduate position, you must have graduated within the past 5 years. And I graduated in April 2021. I wanted to include, I've never been to ANA Membership Assembly, and I've actually never been to any nursing conference. When I was on the NSNA board, it was completely during COVID, so I wasn't able to attend anything live. And I just thought this was really cool. It just shows how the tables are arranged by the organizations, the ANA board, ANA past presidents. Oh my gosh, let me grab my dog. really quick, sorry.
Doc was barking at your dog, Nikki.
I will say real quick, if anybody is interested in running, highly recommend it. I can't necessarily hold your hand through it as a member of the NEC, but highly recommend it. We're always looking for people who are interested or looking at, maybe it's in like your next 5-10 year plan. So think about it.
Absolutely. And then it just goes, I just put the tables how they are arranged just to show I did not know what to expect. And I was completely just blown away at just how the little details and everything, and just how honestly, how beautiful it was to be in a room full of like-minded people who just encourage one another. And it was absolutely overwhelming. And I'm forever grateful. And then this is actually, I just took a video from back just to show you how many people there were and just how, I just can keep saying how great it was, because I was just overwhelmed. And it was one of the best experiences I've actually ever had. For the candidate and election events, they give you a schedule of where you should be to network. And that was, I think, really just how you get your name out there, your story, and just who you are as a person. And what I found is people actually, they don't necessarily care about what you want to bring to the board. It was more about who are you as a person and your personal experience, and who do they want to represent new graduate nurses. So we started off by just setting up my bulletin poster, and just as people would just come up and talk, and just you would network and just connect with one another. This was my campaign little presentation. And when I first went, I had a little bit of imposter syndrome. I didn't know what to expect. So I thought a great quote was, "It only seems impossible until it's done," by Nelson Mandela. And my slogan for the campaign was "Adequate, eager, and able to serve you." And this was also, like I said, once again, I didn't know what to expect. So I just thought everybody would have brochures to hand out. And so I just made little brochures with the QR code for my website and just some of my experience that I have been able to do in my 2 years of nursing, and just a little bit more about me and some quotes from people who are close to me, but also have really been able to shine when it comes to nursing and pushing the profession forward. So for the membership assembly, they asked all candidates, they had 2 minutes to come up and introduce yourself. And after you got to introduce yourself, you had 2 minutes to answer a question that was given the night before. And the question for the new graduate members were, discuss one idea that ANA could develop to engage newer and younger nurses. So my idea that I spoke about was just by promoting culture, structural empowerment, and professional growth that will lead to more engagement. But especially with the new graduate nurses, I've seen that when you allow their voices to be seen and heard, they are more grateful and more engaged and want to do more. And that was what I talked about, and how I thought we could develop to engage newer and younger RNs. Really, for me, the membership assembly personal outcomes, for me, I took, it was more than just taking away what I have learned about nursing, but it was really like this healing experience and learning so much. And so I put, one thing I did was listening, networking, connecting, learning, and just to have fun, because with listening, you were able to listen to other individuals about their stories and how they got involved, and networking, especially to connect for future endeavors, because for all nurses, we all have the same goal, and that's to advance the profession of nursing. And really connecting, because to me, connecting and networking are completely different things. Connecting, you really get to find common ground with each other and really learn about the person, who they are as an individual, rather than their title as a job. Learning, we did a lot of that. An example of that is the dialogue forum and what other organizations are doing to advance nursing, and really just to have fun and enjoying each other's company. I will say that this board is a lot of fun, and I encourage everyone to attend the next membership assembly and get a little piece of that pie. So these are just some pictures that I had to really just kind of show just how fun it is. And if you can see, everyone's smiles are just so authentic. It was just absolutely amazing to witness it and really just be involved. And that we had at the top right, we had happy hour, which is great food and a lot of fun as well. Oh, let me go back so you can see just more fun and just really networking with everyone. So there were a total of 3 candidates for the ANA Director at Large recent graduate with a total of 446 votes. And I can luckily say that I was voted in as 2024's ANA Director at Large recent graduate, and really being supported by the Minnesota Organization of Registered Nurses and representing Minnesota. And this is what I call the dream team, all of us there. And I just want to say a huge thank you to the dream team, Molly, Sarah, Mary, Heidi, Kathy, Cami, Stephanie, and Jennifer, because without your support and your encouragement, I would not be able to be where I am today. And it is something that I will hold on dearly for the rest of my life. So thank you, everyone. And that is it.
Yeah, that makes me smile just to think about it. It was so much fun. And Nicole was such a good candidate. I mean, you support whatever candidate is you have, and sometimes it's just so easy because she was so good, and people just would come up to me and say wonderful things about her that I thought, well, I can't even tell her that. She's gonna get a swollen head for that one. But it was really great. And Minnesota is not the largest state, but we're really pretty good at this campaigning thing. So if any of you ever want to run, just let us know. We'll help.
Yes, and I will say I had a lot of self-doubt because when you saw the paper that showed like how many votes each state got, and other candidates had such a big voting pool which I just assumed would vote for them. But it's really not like that. At the end of the day, like I said, people want to know who you are as a person. And a lot of these people that I thought were just going to vote for that member for their state came up and said, no, we voted for you because we thought you were a great candidate. And like I said, I'm just eternally grateful for this board, for your constant support. And like I said, I am a first generational college student. I'm one of 6 who's only graduated high school. So for me, this was a life-changing experience, really, just to show not only me, but be able to come back with these stories and show my kids that like anything is possible. I have 3 kids, and I also take care of my little cousin, and she just got into nursing school. So that's like another person who's graduated high school out of my family. So that's 1 in 7, and the second one who will be going to college. So I just encourage everyone, if you can, attend, because it's absolutely amazing to just be around like-minded people and just good company. Just good company, meeting people for the first time and people rooting for you just because they are good people. So it was a wonderful experience, and I can't wait for next year.
I just want to add, she was a fantastic candidate. It was so fun getting to know her, though I didn't meet her face to face until we were at ANA. We did a lot of texting back and forth, but I learned a lot from her and the younger generation and all the electronic stuff that they could do. I was grossly overwhelmed by her bulletin board and her video. So I'm very, very proud. I feel like a mother hen. So I also want to thank all the members of MNORN who helped financially to support her, because this is not a cheap thing to go for. She had some wonderful things to hand out, and everybody loved it. So thank you, everybody. So proud.
So with that, we have Cami and Stephanie are going to talk about the dialogue forums. So into the meat of the meeting.
Kathy, do you want to pull up the slides, or would you want me to do that?
If you pull them up, you can advance them.
Okay, it'll just take me a minute or two to get there.
I have to say Stephanie did all the work on this PowerPoint and we're gonna share it in that, but I am getting a storm blowing through.
Mm.
So I'm not sure in Litchfield here, and so I'm not sure. It's looking kind of a little interesting. So if I cut out, it's probably because I lost internet.
Can you see the slides? I'm hoping.
Not yet. Do you want me to?
Mm,
Not yet.
Okay, not sure how to get them into the presentation.
Has it up for you.
Oh, there you got
There they are.
them. Okay,
Well,
very good.
I pulled them up.
Okay, could you go back to number 1, just briefly?
I can.
Okay, oh, well, perfect. So thanks, everyone. And I'm probably a newer member, or at least newer in terms of my activity with MNORN. I've been a long-term member of ANA, probably about 40 years of being a member of ANA, most of that time being when I lived in North Dakota. And then when I moved to Minnesota, became very involved in AAACN, but still always maintained that ANA membership. So I have to say that attending the membership assembly for me was really reigniting sort of my passion in that bigger picture of ANA, and understanding the power, I think, of that large organization, and how our mini nursing organizations can speak with one voice and have a much better opportunity to move things forward. So appreciated very much getting to know my colleagues that I didn't know very well before I went. So my attendance at this membership assembly was really as an organizational affiliate. So I'm the president-elect for the American Academy of Ambulatory Care Nursing, and we've been an organizational affiliate of ANA for about 10 years. So I was thrilled to be able to go as an invited guest of ANA, and also to be able to vote on many of the issues and for our candidates. So it was a very great experience. So our objective tonight, related to the policy dialogue forums, is really to sort of describe the discussion and outcomes of those policy dialogue forums. And there were 3. So at our last meeting, I think it was our last meeting, wasn't it, Kathy? We had speakers that sort of addressed all of these. At that time, they were the proposed policy dialogue forum questions, and provided a lot of insight for us before we went to the meetings. But the first one is virtual nursing as a practice model innovation. The second is the role of nurses in promoting gun safety and preventing violence. And the third was addressing documentation during a time of crisis. So next slide. So I'll kick us off here, but Cami, just feel free to jump in whenever. This first one was probably the one that kind of piqued my interest because of my role with the American Academy of Ambulatory Care Nursing. And we have a strong, long history of working in that telehealth space or virtual nursing space. This particular policy dialogue forum really relates to the acute care virtual nurse. And you can see some of the tasks that are typically done by that acute care virtual nurse: assessment documentation, admission, discharge, patient education. It was seen that this particular role reduces the burden of the bedside nurse, can be a nurse satisfier for nurses who prefer to work in a remote capacity. Ability of the virtual nurse to mentor less experienced nurses. So sometimes you have more nurses working at the bedside that don't have as much experience as some others. And so the virtual nurse can provide that additional mentorship. And then, of course, it allows us to utilize new technology to create innovative new models of care. Next slide. So lots of discussion on this policy dialogue. I think we perhaps in its interest in sort of being inclusive to ambulatory care, we kind of went down a little bit of a rabbit path for a while, trying to make This policy dialogue fit all applications, and I think in the end, having it really focus on acute care was really the best option for this. But lots of discussion about allowing RNs or facilitating RNs to be involved in the care delivery design of these innovative practice models, and the importance of having consumers involved in the design. And we heard that from the presenters that we had at the last meeting too, that consumers aren't always on board with some of these new models of care either. This, again, could support retention of nurses who might otherwise leave the profession. But there were a lot of concerns expressed regarding how this new model could impact staffing models. So how would this affect staffing ratios? And would it really support the bedside nurse, or would this mean that the bedside nurse might actually be assigned a larger assignment? So the actual recommendations were to, as listed here, to develop a national policy that addresses standardization of virtual nursing, and considering those funding and reimbursement models and implications related to licensure, regulation, and liability. Advocate for the technology that meets the nurse and patient needs. Support data collection on virtual nursing so that we can understand its impact. And ANA recognizes virtual nursing as a source of support for nurses at the point of care, but these virtual nurses should support, not supplant, nursing staff in nursing ratios, matrices, or other measures of staffing levels. So again, lots of discussion regarding the impact of the virtual nurse on staffing ratios and models. Cami, feel free to jump in here.
Can I say something quick too, Stephanie? Excellent presentation on this. Two things I think that stood out to me on this particular model and how it was presented. I, as a family member or friend, I should say, who experienced virtual nursing in Mayo, I think a lot of the focus was on what benefits the nurse, and a little less than could be on what benefits or could harm the patient. In my experience, there was a lot that was left out of a discharge that was very, very complex. A friend had a 14-hour cancer surgery, was discharged with a urostomy and a colostomy, and there was no planning for discharge, post-discharge follow-up with a home care nurse, or ostomy supplies at home for delivery. That's an example. And it was a virtual nurse discharge. So, and the virtual nurse tried to interrupted PT, OT, pharmacy, and nursing in her room, called in about 6 times in 2 days. So it was very disjointed. So I think more ought to be done from a patient experience perspective on that. And the second thing that I think came up and can't be forgotten, I'm just going to put a little plug in Martha's ear, is what is the patient risk or the ethical risk in some of these models, because there's some of them, if I remember correctly, there's like observation cameras in there, so that the virtual nurse knows when to call the patient. So there's like cameras in the rooms to make it easier for the nurse. And what is the ethics around that? What's the legal, should patients know that there's cameras and people watching them? So that's another piece that I think it has yet to be explored fully. And I'll stop there. Thanks.
Great point. Cami, did you have anything you wanted to add?
No, I mean, I think you're absolutely right that there was really a robust discussion about this, and you know, we view nursing as really this touching field, right? It's touching the patient, it's being with the patient and all that. And so I think there's a lot of, as Heidi said, there's a lot of unknowns as to what technology can enhance it, what it is, what is the risk as an organizational risk, what is the risk as a patient risk, what is the risk of the liability of the nurse on both sides. And so there's a lot, I think, at least this starts to open up the dialogue and take some support in saying we recognize that this really is going to be a part of nursing in the future. And how do we become in the forefront of it to support it and yet have some guidelines? And as you said, Heidi, I think so well, what are the ethics around it? And that's going to be a huge discussion because technology is real and it's here.
One of the things that they talked about too also was the issue of AI, which is becoming such a big talk about. And who knows where that's gonna play in the healthcare system, so that's the ethics and the legal part of it too, so.
Great points.
Mhm.
Yeah, I think this is a topic that we'll be hearing more about in the next couple of years at A&A.
We have a lot to do.
Yeah.
We have a
Yeah,
lot to learn. I think we have a lot to learn about this as
Yeah.
well.
Yes, the learning curve is incredible.
yeah. I think it's great to see ANA coming out on this side of it though. Because we know that the technology is going to grow and change and become, it's going to we're really at the forefront of it. And it's really going to become evolutionary, and certainly we want to be at the table as nurses with it, especially if it's going to impact our patients.
So the next topic was the role of nurses in promoting gun safety and preventing violence. And just a few comments from the briefing document. Gun violence impacts individuals and communities across the nation. We certainly know that. It was estimated that over 45,000 deaths occur each year in gun-related incidents, and these are increasing. ANA views gun violence as a public health issue requiring action from many stakeholders. So we know that this isn't something that nursing can fix, but we need to have nursing involved along with individuals, organizations, and legislators at the state and national level. Next slide. I think with this one, there was a little bit more broad consensus during the policy dialogue discussion. There were some sticking points regarding the meaning of risk and protective factors. So there's comments in the policy brief regarding risk and protective factors. And I think probably there was a bit of a lack of understanding across the membership assembly as to the meaning of some of those. And so there was some editing and wordsmithing that occurred during the course of the dialogue forum. Lots of discussion regarding application of evidence-based strategies so that, you don't just throw out some action, but you really, as we do in nursing all the time, try to find the evidence for what's really going to work to address gun violence. And the need for nursing education on the underlying causes of violence and the need for early intervention, particularly with our children, our youth, our adolescents, and our young adults. Next slide. So here are the recommendations that came from this policy dialogue. Again, advocating for meaningful legislation to address gun safety and firearm access and increase funding.
Editor Friedman a lot.
For mental health services, gun violence and prevention research, including research on gun violence against healthcare workers and settings, endorsing the American Academy of Nursing's firearm safety and violence prevention and updating ANA's position statements, and promoting nursing knowledge on the relationship between gun violence, public health, risk factors, and protective factors.
Last, you know what I mean? And then we'll
I
just.
don't know if we have someone who needs to mute.
I mean, I'm just saying, it's too much to waste.
Were there any comments on the gun violence, or should we move
That's
forward to the third?
I think that there was a lot of discussion on this, and I think that what probably struck me the most about the gun violence one is just how broad, as you pointed out, Stephanie, how broad the support was, but also how broad the problem is. I mean, throughout, including, Nicole, there is gun violence that has affected so many people and so many nurses. And it has become a health risk for the nurses as a profession. And so again, I think as the ANA took the stand of revisiting this and really endorsing the things that we can do, but definitely it's an important problem, and it is a health problem. And I think that was so evident in the room of nurses.
that full during the.
I
fall.
thought it was
wanna-
interesting too that states where some of the states that we would call red states where they aren't really in support, the state isn't in support of reducing or legislation around gun violence, how the nurses and the meeting said how important it is that ANA takes a strong position, because that's the position that they can take to their legislators then. And so they weren't saying, oh, you have to win the state because of our needs. It was, we need you to be as strong as possible because we work off of your strength.
Yeah.
Great point. Next.
Gonna offer to keep this.
The last policy dialogue forum was regarding addressing documentation during a time of crisis. And as we all probably recall, during COVID-19, with all the severe staff shortages and issues in especially in our acute care facilities, our nursing administration was able to somewhat reduce the documentation burden during that time of crisis. So the nursing burden of documentation was eased, but it sort of left these lingering questions regarding safety and regulatory concerns, and whether or not reducing our documentation was opening up our nurses for other types of liability should something occur. So lots of questions about that. Next slide. And again, discussion that was raised during the forum centered around the burden of documentation. There was many comments about documentation burden in general, but we kind of brought that back to documentation during a time of crisis. But definitely concerns expressed regarding compliance with regulatory and safety standards. And the idea that we are all going to continue to have one type of crisis or another going forward. And so this is a good time to really think through what we would do in order to be prepared for a crisis if we did want to streamline our documentation systems, to have that all proactively discussed and considered.
Well, yeah, I can't remember which one of the states it was that brought up the fact that they had suggested or put forth reduced documentation and found out from their board that that was against some of the board's statutes. Can you guys remember? But they brought that forward, that they were told that that was that was a problem. And so that was news to me, that that the Board of Nursing had concerns in that regard, specific to a hospital's documentation policies. But
yeah, I can't recall. I remember that discussion, but I can't recall what state it was. I don't know if you do, Cammie.
I want to say it was Oregon.
That sounds correct to me.
I think you're
don't
right.
know. Yeah. So the recommendations that were finalized at the time were to generate a national consensus for research and policy development to lessen the burden of nursing documentation, particularly during a crisis or emergency, using an all hazards approach. So you can kind of see there was a little bit of a flavor in here regarding documentation burden in general, because it does say particularly during a crisis. Partnering with regulatory agencies and stakeholders to review current documentation standards and revise policies that reflect a national standard for crisis documentation, especially for nursing. And involve experts on nursing professional liability and state regulation to ensure that these revised standards of documentation do not expose nurses to additional legal or regulatory risk. Cammie, anything you add?
Well, I think there was a lot of really good, robust discussion about this, and I think that this is I think that the sense, and you get me, you tell me if I'm wrong, but there was somewhat of a sense like we're always going to have documentation. It's always going to be a problem that we're not going to be able to get it done. And we can't believe that anybody can do anything about it. And so I think that was kind of the feel of it. And so I think there's a great opportunity here for ANA and our board to take some of the look at that. I don't know, Kathy, I saw you lean forward a little bit. Was that your take on it too?
Yeah, I think documentation has always been an issue. It'll always be an issue, whether it's electronic or any other way, but it's a great opportunity to look at what's really important in documentation and what's just more information that's not useful, period. And especially during a time of crisis, because and I know that there's a lot of people working on it, but it's a work in progress always, and it would be nice to see some outcomes sooner than later.
Yes.
The one thing that stuck with me from the MNORN presenter on this issue was the redundancy that the documentation has, and somebody's got to be able to clean that up. A lot smarter than I am, but they shouldn't have to say the same thing several times in your documentation, in several spots in your documentation.
Well, and then we have to get rid of that. If you don't document it, you didn't do it.
Yes.
Philosophy that we learned from the minute that we start nursing school.
Right.
And I
And we
think-
tried to do the charting by exception, right? That was always going to be the charting by
Right.
exception. And where has that gone?
Well, and
Okay.
when I was on the, for my innovation committee work, I was on the data science team and with some brilliant informaticists. And one of them was working on a project, it's called the de-implementation project. So kind of when you put something out there in the world of Epic, nobody ever comes back and it says, well, if you add 10 fields, you have to take out 10 fields that nobody uses. Because nobody had that, I shouldn't say nobody, but there's a lot less intention about cleaning up when you add something else to the record. And so there's been some focus on that as well. And I think it was triggered by the Lorna Breen Act, recognizing this high rates of suicide amongst healthcare workers, particularly doctors in the face of COVID, that they could trace back to some of that burden.
So,
there's something being done, but-
I think also just the fact that, it's built on an Excel platform, so you can just easily add a row. So, you can, Epic can take away things, but then it gets customized back by the individual hospital. So it's to teach everyone that, one of the things we had success for when I was at Abbott was we would say, is that documentation worth $1? Because if you say it is, then multiply that by how many times that's going to be done. And if it's of that value, then sure, put it in. But if it's going to cost thousands of dollars to answer that question that's not really important, then maybe you should not have it. So making the business case to decrease documentation was something that helped us a lot.
I also just want to add too, it's having that consistency. So when I started as a nursing, I was told, you chart with by exception. So if you go through a chart, whatever is not correct, you see it sticks out. And when I switched units and was on orientation, they were like in the ICU, it's like, no, we chart everything. So every single nurse coming in is being taught something different by what their preceptor's standards are. So it's just, some people like extra documentation, some don't, but there's just no consistency in that either.
I knew a nurse who liked filling in all of the cells because it looked pretty that way. So it is, we need to have standards and people need to follow them, and that's the thing.
Yeah. There is that tendency that if there's a blank there, you feel like you're compelled to fill it in.
Mm-hmm.
And I would just say, just off of that topic a little bit, is that when I went to assembly this year. It felt like, okay, it finally clicked. Last year, I felt a little lost as to what was supposed to occur and all that. And so I do encourage people to follow the issues and to really kind of pay attention to the work that's done out there, because so my second year going, it is, as Nicole said so well, it really is incredible to see so many people, like-minded people working on issues and having those voices out there, whether it's at the Capitol, whether it's in a room with strong nurses, strong-minded people. And that is how the work can get done. And so it's a great place to go and to try to have your voice heard.
I also want to add too, it's in today's world, there's such an emphasis on where are you politically, and that has divided so many people. And I met so many people when like talking to them, like maybe politically we do have different views, but we actually have so much more in common. So it was just a beautiful thing to see, like, yes, you might have different views, but none of that really matters because we just love people and want to take care of people. And we actually have the same common goals at the end of the day. So for me, it was very, like I said, I can just say life-changing, because I have only had negative experience with some people on a different political side than me, with like family members and things like that. But then to see these people that say, no, I believe in this, but then we just see like we have so much common ground. And at the end of the day, it really doesn't matter what you believe politically. It's about who you are as a person and the work that we are all trying to do and accomplish. So I just thought it was a beautiful, beautiful thing.
So MNRN will be electing in November, we'll be electing representatives to membership assembly. And so if you're interested, you should run, because we end up the president goes, because of the bylaws say the president is a representative. We have 2 other representatives, and we take I think 3 alternates, and this was our largest delegation we've ever had. And we filled a table, and we were pretty awesome, as you can tell by the presentations. So we've hit the 8:04 mark. Does anyone have any final comments? I think everyone did a great job. It was really a fun discussion. And you'll be getting an evaluation in an email, and then I'll send a certificate of attendance after that. And I think that's what we have for tonight.
Okay.
So,
Kathy, I want to just say a couple things.
yes. I'm sorry, Mary.
Oh, no, that's okay. I know we're out of town, but I just want to say that MNORN has done a great job in getting its members ready for the ANA topics and for participating in the actual event too. With what we do, first of all, we ask all our members, what topics would you like to be represented? You know, for these different things, we get the list, and then the list is evaluated. What really comes out, what is some of the top of the things on the list, but it's also forwarded to ANA, and we can send it and we can document. So that's really good. And then we do have a meeting for our members too, to identify what are the topics, what do you want to discuss, what can you all give to everybody, especially who's going, and what we can represent there. Like the virtual nurse topic was a good one. You know, it was new for me. I haven't been able to do that. So just to hear about it, what people are doing and what some of the issues, it's really good. So MNORN does a good job for all of its members. So I would encourage all of you to, as Kathy was mentioning, sign up to go for next year. It'd be a good opportunity to do that.
I would just really like to thank everyone that went and did such a wonderful representation for us here in Minnesota. I mean, we could not have been more professionally or represented, and I'm sure you made us all look great. So thank you very much for that.
Thanks.
think you would all like to know that it is cooled off to 87 degrees here. And so also, I'm gonna go out and run around the block a couple of times. No, I'm not.
Be sure and take water.
Thanks,
All
everyone.
right.
Bye.
Have a good evening, everyone.
Okay, goodbye.
Goodbye.
Thanks, everybody.
Thank you.
Yeah.